The typical American family is no longer typical.
2 kids, 2 parents, and then kind of out of nowhere, divorce.
In the U.S. and Tennessee, 64% of parents are married. 1 in 20 children in Tennessee is raised by a grandparent.
I knew that I was going to be a grandparent, but I did not think that I would end up having to raise my grandson.
35% of U.S. children live in a single-parent household. In Tennessee, 71% of African American children live with a single parent.
We have 24 million children who wake up in America who will not have the presence of the father in their home. That's a huge number.
Statistics show children without 2 involved parents may live shorter lives. Children living with step-parents in single-parent households and with grandparents are at greater risk for behavioral problems, mental illness, asthma, dental problems, and obesity than children living with 2 biological parents. Children without 2 parents are more likely to become parents as teenagers. They have a greater chance of being incarcerated in their lifetime and are more likely to live in poverty.
Major funding for NPT Reports Children's Health Crisis is provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the HCA Foundation on behalf of TriStar Health, and by the Metro Public Health Department through a grant from the U.S. Department of Health and Human Services. Additional support provided by the Baptist Healing Trust and by members of NPT. Thank you.
Hi, I'm Kimberly Williams-Paisley. As any parent can tell you, raising kids is a rewarding but difficult job. We are our children's first teacher, their provider, and the center of their lives. When one parent is unavailable or uninvolved, that job is even harder and can put more stress on the family. While all families will face challenges in their lifetime, how parents deal with adversity will shape their child's development and have lasting implications for the health of the entire family. Join me for this edition of NPT Reports, Children's Health Crisis, as we explore the role families play in the health of Tennessee's children. Stay tuned.
When your kids are born, you have this idea of what your family will be like, what your kids are going to do. You know, when my daughter was born, I thought, oh, we'll do dance lessons and it'll be great. My son was born and, you know, 2 kids, 2 parents, their dog, great grandparents. It was great. And then kind of out of nowhere, divorce.
I knew that I was going to be a grandparent, but I did not think that I would end up having to raise my grandson. It was a situation that he could either go to the Department of Human Services or the grandparent come and step in and take over. So he came home with me. He was born in a hospital, and the day that he was released, after 3 days, I had to be there to pick him up and take him home. And he had been with me all the way up for the last 4 years.
Family structure in the United States has changed dramatically in the last 50 years.
There have clearly been huge increases in divorce compared with 50 or 60 years ago, but that has kind of slowed down now because people aren't getting married as often. We're seeing major delays in when marriage happens. Related to that, we're seeing large increases in non-marital childbearing in the 20s. Children who are born to unmarried parents in their 20s don't do much better than the children born to teen parents. So that's a major change for family structure and children's well-being. Children from single parent and other complex families, they tend to have higher rates of most health issues. And those are not only physical health issues, but emotional and behavioral health issues.
Family structure affects the availability of 2 important resources: money and time.
Are you finished? Let's take dishes. Being a single parent is hard. Everybody get your dishes. You're kind of thrown into it. You know, you go from a 2-parent family where the responsibilities are kind of divided to doing it all, and not just with the kids, but kids and work and house and bills and yard and laundry. And so it's just kind of consuming and trying to figure out, you know, you've just gone through this enormous emotional just train wreck, and trying to keep that together as well and not have your kids suffer any more than they already have.
On the ball. Whoa, good job.
The first thing I thought about was, I thought I was done with this. I had already raised my daughter, and I thought this was going to be a time for me to have my life. But I also had to take in consideration that this little infant did not ask to be here in this world.
Run, run.
I did everything any other mother would do. I get him up, I bathe him, I feed him, I take him to daycare, I read him stories. Anything any mother would do. The only thing I didn't do, I didn't birth him. It was one of those type of situations. Basically, I was on my own. I was really on my own.
Another way family structure can affect child wellness is through exposure to stress.
I think we can recognize that all families have stresses of one kind or another, so family structure is one type of stress. If children are exposed to all kinds of changes, you know, people moving in, people moving out, a marriage being formed, a marriage ending, cohabitation happening and cohabitation ending, that's really hard on children. Parents in these kinds of families are more likely to be depressed, and that affects children. I mean, we know from lots of research that children who are exposed to parental stress and depression develop less well.
When you raise your right hand and swear to defend the Constitution of the United States against all enemies, foreign and domestic, you know what you're getting into, that you're going to put your life on the line to protect our country. Did we think it would ever happen to this extent? Probably not, but that's what we trained for, and that's why we signed up.
In the last 10 years, the military has become acutely aware of what happens when family structure is disrupted. Long wars, repeat and frequent deployments have affected not only soldiers, but their families.
I've lost count of the number of deployments he's done. I just know it's been a lot, more than being at home. The stress level has gone up exponentially since 9/11. Harm's way is now a way of life for anybody who's in the military now.
We think of stress in a lot of situations being like a rubber band. When we're all stressed, we stretch the rubber band, but we know that if we stretch it too many times, it no longer does its primary function, which is holding things together. And what we're trying to do is hold the family together and make everything work functionally.
Your commanders told you downrange, take care of yourself and take care of your buddy. And today I would add, take care of your families. Welcome home.
Because of the connections between family and soldier readiness, Army Medical Command has declared family health a priority for national security. Medical Command has focused particularly on the impacts of deployment and breaks down the deployment cycle into 3 phases: pre-deployment, deployment, and redeployment back into the home environment. Each presents a unique source of stress. How a child responds to the stress of deployment can depend on their age and development.
During the deployments, it varies with each child, and then it varies with each deployment as they get older and they mature. Last year, my then 7-year-old son, whom I thought was handling it very well for a while, just all of a sudden started misbehaving in the classroom, refusing to work, being belligerent, back-talking, destructive, just not typical of his behavior. And initially, I just thought he was being a stubborn little boy trying to exert his independence. And it's like the light bulb went on. That makes sense. He's not just being a stubborn little boy, he's having problems coping.
Easy rule, stress isn't fair, it's not equally distributed, and some members of society carry a much heavier load of stress than others.
Now we're going to go through the instructions for the task. The task is called
Dr. Bruce Koppas and his team at Vanderbilt University study stress.
What we're trying to do is solve the puzzle of why it is that if I have 10 people all exposed to the same stressful circumstances, some of them seem to get through it and they are resilient, and some of them seem highly vulnerable. And so the task as a stress scientist is to figure that puzzle out.
Scientists like Dr. Kompas have found that humans are not ideally equipped to respond to the stressors of modern life.
We are wired to make that classic fight or flight response to things. Our body revs up our heart rate, shuts down things that we do in our body that are long-term maintenance for us, and revs up the things that we need to do for short-term response. So that's an acute stress reaction. That's a good thing. It's a healthy thing that we do that when we have something immediate that we need to respond to. The problem is that same acute response gets activated hour after hour, day after day, week after week, in response to chronic stressors, things that keep recurring. And that's where we get into the problem part of stress, is we keep revving up those biological systems, we can't make that physical response, and that's where wear and tear on the body and on our emotions starts to come in.
Wear and tear from chronic stress has been connected to increased risk for developmental delays, anxiety, depression, cardiovascular disease, asthma, diabetes, and even certain recurrences of cancer. Most of these consequences show up later in life, but the earlier someone is exposed to chronic stress, the higher the risk for negative outcomes.
Children are more vulnerable, so they don't have the resources personally to deal with awful things that can happen in their lives.
Yeah, 1 second and I'll fix it, okay?
A child's developing brain is especially vulnerable to stress.
Stress affects brain development and brain function, particularly in those prefrontal regions that we use to try to cope with stress. In those prefrontal cortical regions of the brain. They're the last part to develop. They're developing all the way through middle to late adolescence. So here's a double hit. If I'm under chronic stress, that's having a direct effect on me. It's at the same time, it's potentially eroding the part of my brain that I need to use to try to manage my emotions, to solve complicated problems. And that's a scary thing about early stress, is that the stakes are incredibly high, because not only might there be an immediate effect on a child, it could carry forward into later life. The flip side of that is that's a great opportunity. In terms of physical development, emotional development, even brain development, children are malleable and able to bounce back and recover. So early, high stakes, high risk, potential high benefit.
Reducing the stress young children experience means focusing on parents.
Let's go play. Yeah, come on.
So if we're trying to help reduce the adverse effects of stress, why focus on families? Families, that's where we grow up. That's where children learn about how to cope with stress in their lives.
The 0 to 6 years are key in laying the foundation for the child, because you're starting out, setting the way that you see the world. Is it a safe place? Is it a loving place? Is it a place that you can really thrive in? Or is it a dangerous place? Is it a place that you're not quite sure what's going to happen, the next time you turn the corner? The world of influence is fairly small. It's their family and the environment that their family creates for them.
When I got divorced, my son was 2 and my daughter was 6. And it's funny because I thought a 2-year-old, it's not going to be affected at all. He really struggled. I was at a complete loss. I just was so frustrated. My son had major anxiety and had started acting out. He was getting aggressive with his sister, aggressive with me, and everybody was mad or frustrated and completely exhausted.
Okay, pick one of these 2 toys to play with. Okay.
At a friend's recommendation, Aaron contacted the Regional Intervention Program, also known as RIP. RIP provides evidence-based behavioral and developmental health interventions for children aged 0 to 6. Interventions are hands-on. Participating parents act first as students, then teachers with their children.
When you come to RIP, you are learning all these different parenting skills. You learn all about what to do in times of frustration, when you're frustrated, when your child's frustrated, kind of ways to head off those triggers. Just trying to make the entire environment a lot more positive.
Together, parents at RIP learn what kinds of environments set children up for good behavior and healthy development.
The best kind of environment that a young kid can have is one where there are routines. Routine is really important. Rituals are important to a child. They need to know what's going to be happening from one time to the next. And that doesn't mean every minute, but that they're confident that I'm going to get breakfast in the morning, I'm going to school, I'm going to be fed at school, those kinds of things. It's something, they aren't having surprises all the time.
RIP helps parents identify a particular behavior. Parents then learn to shape their child's behavior through positive reinforcement.
No, I'm making using your nice words.
We're going to ask that parent that whenever they see the child doing something that they like, that they want them to do, that they're going to give their attention and lots of it initially. Very specific acknowledgement of what the child's doing right. And at the same time, unless it's a dangerous behavior, we're going to ask that parent to try to pull their attention away from the child.
I call it light on, light off, because it's just like a switch. You turn yourself immediately off when the child is misbehaving, and as soon as the child goes back to what you want them to do, you immediately turn yourself back on and give the child a praise.
Nice job, 10 extra minutes for tomorrow. We started with just verbal praise for the little things. If he asked me, you know, Mommy, may I please do this, instead of, I want to do this right now, you would say, you know, nice job using your kind words. And then eventually, with the help of some of the staff members at RIP, we put together these plans. Spencer really loves playing his Kindle. So we said, okay, you can play your Kindle for 20 minutes a day. Now, you have the opportunity to gain 10 extra minutes if when it's time to go to bed and I say everything's off, you turn it off. 4 minutes left, buddy. Before, it would have been, unless you turn it off, I'm taking the Kindle away. And just that switch into this, you know, a more positive environment, you have the chance to gain things. Here's your incentive instead of, I'm taking things away. It made a huge difference.
We're at an incredible time right now where we're seeing so many different kinds of family structures. We're seeing same-sex families with 2 dads, same-sex families with 2 moms. We're seeing grandparents raising children. It's just an incredible heterogeneity of types of different families that are out there. It comes down to, do you have loving people who are looking after that child? And that includes things like reading to the child, making sure they're eating nutritious meals and foods, and making sure that they're also out and active in the world. If that's the case, then that child is going to do well.
You ready to go to the park?
One area that we really have not focused very much in is the role of fathers in families. We've kind of moved away from the traditional 1950s, man goes off to work, mom stays at home with the 2.5 kids. And we're really moving into a world where more women are in the workplace, more men are stepping up in their child care duties.
That's a pretty yellow flower.
There's excellent evidence out there that the more involved a father is, the less likely that child is to engage in sex, the less likely they are to have delinquent behaviors, to smoke, to drink, the less likely they are to have mental health problems, depression and anxiety, the more likely they are to do well in school. So when you put all those things together, one of the greatest places that we could really focus our attention with probably a good return is on the role of fathers and families.
Amelia.
While more fathers may be adding the role of nurturer alongside their traditional responsibility as provider, father absence is still a common factor in child health outcomes.
Every child knows that they have a father. When that father is not engaged in that child's life, it leaves the child to wonder whether or not the father loved them, whether or not the father even wanted them. There's that emotional weight on that child that child carries through life, which creates additional stress and things that you wouldn't wish on any child.
When I was 6 years old, my parents divorced. The family just basically disintegrated. That was the end of my male companionship with any male, because I didn't have a grandfather. My father was missing out of my life. So I remember significantly at 8 years old that, you know, I really felt like I was kind of by myself a little bit. You know, I mean, I had my mother, but as far as my connection with any males, that was pretty much the end of it.
What are you expecting to get from the boot camp, and what made you want to sign up?
Nashville's Public Health Department is testing a series of efforts to encourage father involvement in the lives of their children. The New Life program focuses on fathers to maximize the health and well-being of Nashville's families. One of the New Life program's strategies is a boot camp for new dads, capitalizing on the anticipation of an expecting father.
We wanted to focus specifically on providing education to fathers to ensure that they had all of the skills, the knowledge, and the confidence to be able to be engaged and involved in their children's lives from day one, and even before day one, during the time when mom is expecting.
I think that the traditional notion of who raises the child and who nurtures the child has influenced father presence and absence. There are really only two things that a mother can do that a father can't, and that is birth a child and breastfeed. Beyond those two things, it's negotiable.
Another way the New Life program is working to encourage father involvement is by helping absent dads reconnect with their children. Using census data, the health department is targeting the areas of North and East Nashville, which have the highest number of female-led single-parent households in Davidson County. Participating fathers attend workshops twice a week for 8 weeks.
With the New Life program, we want to get across to fathers that they are important in their child's life. We are also providing education directly to the fathers that will help them make positive decisions, help them to gain employment, and to help them overcome any barrier that will prevent them from being involved in their children's life.
The barriers that some of the New Life dads face are substantial.
When I first became a parent, I really wasn't a parent. I was a teenager. I was a kid. From 19 to 28, I probably just lived without ever really trying to be somebody. That basically led me to trouble. You know, that led me down the wrong paths, and I made the wrong choices. In the long run, that ended up causing me a lot of pain on down the line.
You have some dads that come in with depression issues, some dads that come in with drug and alcohol abuse issues, others that have issues paying their child support. Many times, the reason why the fathers are behind on the child support is the employment issue.
Employment opportunities for dads like Ross are limited. In 1998, Ross pled guilty to a first offense felony drug charge and was sentenced to 2 years in prison. The time Ross spent in prison changed his perspective. The felony charge changed his life.
After those 2 years of paying my debt to society, I thought that it would be over, but once you go behind those bars, it never goes away. Every job application is asking, you know, are you a felon? Have you ever been convicted of a felony? I'm not that person today, and I'm a better man than I ever have been. But it still haunts me. It still haunts me.
Ross is pursuing an education to create a better future for himself and his children. But during his time in prison and while in school, his child support debt has grown to nearly $30,000 and resulted in his driver's license being revoked.
The challenges that I faced in trying to be the father that I would like to be, they are great because the relationships are destroyed between me and the mother. So there's a barrier of pain that we have to somehow get through, and it's hard to find your way through that. The child support system is constantly bearing me under more and more pressure. You know, although I'm trying to meet their expectations of me, of what a father should be. You know, it's easy to give up, and that's what I feel like my father did. I feel like he succumbed to the things that, you know, were facing him. But I fight through all of that just because my kids deserve it. And once I get with my children and it's me and them, I mean, all the barriers are broke down, and we love each other. We genuinely love each other.
At the end of the fatherhood workshops is a graduation ceremony, celebrating the renewed commitment of participating fathers. Robert Taylor also hopes to expand the message that fathers matter beyond the individual family served.
I think that we have to move as a society to addressing issues not from the individual level, but from a community standpoint, developing a community that is supportive of fatherhood, working with the systems and agencies and the policies that affect fathers and families. And if we can work together as a community, we can really make some movement to where we're eliminating the issue of fatherlessness.
I think the American ethos is to pull yourself up from your bootstraps, and that works in some situations, but I think mothers and fathers could benefit from a hand up in the very early 0 to 3 time frame, which I think is something that the United States is behind in.
I think one of the important things that we can offer is hope. Even with all the challenges that families and parents are facing now, there is a fair amount of research that shows that in a child's life, even if there is one adult that takes a special interest and really puts a lot of time and energy and support into that child's life, that can be a life-changing, positive influence on that child.
Ensuring that the family environment is as strong as it can be for every child in Tennessee is not easy, but the time and effort we invest as parents today and as a community will make a difference for generations to come. Please join me in learning more about the children's health crisis in Tennessee and what you can do about it by tuning in to NPT's ongoing coverage and by going to wnpt.org/children's health.
Major funding for NPT Reports Children's Health Crisis has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the HCA Foundation on behalf of TriStar Health, and by the Metro Public Health Department through a grant from the U.S. Department of Health and Human Services. Additional support provided by the Baptist Healing Trust and by members of NPT. Thank you.